It's past 12 Central African time. Humanitarian operations have been suspended in parts of South Sudan after escalating violence forced aid agencies to withdraw from key areas. Save the Children says it has relocated more than 45 staff and suspended operations in Jonglei State following a surge in fighting. At the time of the withdrawal, the organization was providing critical health, nutrition, education and protection services to around 100,000 children in the town of Akobo. The suspension of services comes after Sudan's military ordered civilians, NGOs and UN agencies to leave the area earlier this month. Save the Children is now calling on all parties to the conflict to respect international humanitarian law and ensure safe access for aid agencies. For more, we are now joined on the line by Director of Program Operations at Save the Children in South Sudan, Nwamaka Ifionu. Nwamaka, thank you.
Thank you very much. Good afternoon, and good afternoon to the listeners.
Thank you. Can you tell us how dangerous has the situation become in South Sudan?
Well, dangerous is an understatement at this point, particularly in the Akobo area. Following the issue from the military forces on the 6th, asking NGOs, humanitarian actors, and civilians to evacuate the area ahead of an offensive planned within a 72-hour window. We saw mass displacement of persons who have already been displaced within the area and of civilians as well as humanitarian actors away. An abrupt packing and, seeking safety. And this has led to complete disruption to humanitarian services there. But more than that, we've seen in the immediate aftermath of that 72-hour window, an uptick in violence, shelling, active fighting, looting, and just ongoing violence in the area over the past week. So when I say dangerous is an understatement, it is unsafe at this point for any civilians to be within the Akobo area.
Now, around 100,000 children were receiving services. What happens to them now that aid operations have stopped?
As you can imagine, the need to pack up and seek safety in a short 48 to 72 hours meant that they were running with very little of their belongings, but it also meant that they have now seen a truncating to the services that they may have been receiving. This includes nutrition services, health services, of course, a disruption to ongoing education in the area. So these children are now without basic and essential life-saving services that they were receiving. But more than that, they are displaced, far away from home, with limited access to food, no safe drinking water, almost non-existent sanitation facilities, and just disruption to care and life-saving services that they were receiving, of course, amongst other protection concerns. And this is particularly concerning because it exacerbates an already poor nutrition status for many of these children. And all of these together end up compounding into risk factors for disease outbreaks like cholera and the like.
Now, what are the biggest risks that children are facing right now?
If you can just imagine children living out in the open with their families, camped out, away from home, without food, without safe drinking water, no shelter, and no sense of immediate hope, no sense of when they get to return home, no sense of whether things will normalize. And in a distance, they can see the shelling, they can see the fighting, they can see all of that going on. These, in addition to the living conditions they find themselves in at the moment, already pose risk factors to their health, but it also poses to their physical health, but it also poses risk factors to their mental health, just wondering what is to come in the days ahead. And then on top of that, we're talking of the potential for disease outbreak if they remain in that condition for a protracted period without access to safe drinking water and with limited sanitation services in the environs. So your guess is as good as mine when I say that children right now are predisposed to severe risk factors to their health and to their overall well-being.
Now, we understand that hundreds of thousands of people have been displaced. Where are these families going, and what conditions are people living in after fleeing the violence?
So within Akobo town, following violence that had started back in December, there was already an upwards of 80,000 persons displaced from the larger Jonglei area, living in the Akobo East region. These persons who were living amongst host communities now had to be redisplaced along with other civilians and indigents of the Akobo East area themselves. Many of them have fled into neighboring Ethiopia and the regions around there in search of safer grounds and places where they can be, at least in the immediate, assured that no immediate harm is coming to them, no shelling is dropping around them or bombs dropping around them or anything of the sort. And so many of them are taking refuge in the border area between South Sudan and Ethiopia at the moment.
And finally, as we wrap up this conversation, what would need to happen for aid organizations to safely return to Akobo?
An assurance that civilians will be protected. At a time like this, it is critical to re-emphasize that the protection and safety of civilians should always be priority, especially even in the midst of escalating conflicts. And that's why Save the Children is calling on all parties to the conflict to prioritize the protection of civilians, to respect international human laws, and ensure that safe, sustained, and unhindered humanitarian access is restored so that civilians can go back home and rebuild their lives, but also so that actors can go back home, go back to Akobo, and resume the provision of critical life-saving services to populations that so direly need them.
Nwamaka, thank you so much for your time today.
Thank you.
Okay, that was Director of Program Operations at Save the Children in South Sudan, Nwamaka Ifionu.